Well, first of all, we're all paying. We're paying through our criminal justice system. Our jails are the biggest mental health institutions in this country. We're paying through, law enforcement, through firefighters, through a whole host of other ways that emergency rooms, complex disease, all fueled by untreated mental illness and addiction. We don't have a system of care that treats the whole person. Even for people with a lot of money, they don't know how to navigate this system. And even for people with a lot of money, they don't get evidence-based treatment. So this is an equal opportunity offender in the sense that we do not have a system in this country that everyone can say is working for them. Very, very, very few people find that this is a system that works for them. I had an anchor of a major network who everyone knows call me when their child was in an ER. They didn't know what to do. They're a household name. So had a major partner at Goldman Sachs call me, needed help. They didn't know how to navigate it. So like the top people in media, in finance, are also not getting what we all need out of this system. And ultimately, we all pay. We don't have enough young men or women who are qualified to go into the military because they can't pass a drug test. We have teachers not going into education because the challenges of dealing with kids' mental health is so overwhelming. We have kids who cannot succeed in education because they don't understand how their brains work and how to better manage stress. We have employers who are seeing a big portion of their workforce churn in and out every year, much of which can often be fueled by untreated mental illness and addiction. And we have all of this kind of perpetuated by a system that denies mental health care as opposed to treating mental health and addiction. What we ultimately need is we need to have the financing reflect the return on investing in mental health. In other words, there are so many costs to not investing. If we can begin to identify those costs, we can then begin to justify the investments in making sure we have a public health system, because ultimately we only really treat these illnesses after they become crisis situations, as opposed to really going upstream and helping people not succumb to these illnesses in the first place, which would save society, let alone those who are diagnosed with these illnesses, so much suffering and cost financially as well.